Hi, I'm Debbie Fisher, and here's just an inexpensive treatment pearl that you can use in the hand therapy clinic or really any setting at all if you're wanting to work on wrist range of motion. Now, if you've seen in some of the catalogs, the rehab catalogs, you'll see something called the wrist exerciser. And it's, there's different shapes. Some of them are a little more rigid, but they can run from anywhere from from $40 to $65. So this is one way of making one either for your clinic or for your patient that is really probably under $3. What you're going to need is you'll need some floral wire, and you can get this at the Dollar Tree for $1. You'll need some type of bead that has a wide center, or you can use like any kind of a nut or anything from your toolbox. And then this is 6 paper towels that have been folded over and just folded in half like that. And then some duct tape. So all you do is you just take your floral wire and you can just kind of splay it out from the center, just making kind of a nice even fan. And then you're going to take the ends of each one of these, each of the ends, and then you just kind of want to tie them together. So try to find the ends of it, and then you're just going to want to shape this. You can see how easy this wire bends, and you'll really want to get your shape at the very end to what you're looking for. So before you start twisting them together, you do need to make sure and put your bead through there. And then you're just going to take it and you're going to twist them together. Again, look how easy this wire is to bend. You don't need any kind of special tools for this. Just like that. And really, it depends on how wide you want your handle to be. But I just took these paper towels and folded them in half. And you want to have it so that the wire is at the end here, so that you can really bend the wire up over the paper towels to really kind of keep it nice and taut on there. And you could use a dowel or you could use some type of padding on there. You'll want to take it on the edge of the table and just start to twist it. And you want to go pretty tight because you want to make sure it's not going to wobble around in there. So you're going to twist it all the way down the end, trying to keep it aligned, of course. And then once you've gotten that far, then you can take some duct tape. I have some right here already pre-cut. And then you're just going to try to make it more secure, because you still want to clean this and you still want to spray this if you're going to use it in the clinic between hand therapy patients. So the nice thing about duct tape is you can spray it and wipe it down. So you're just going to twist it around like that. And I like to cut a couple of different pieces so that they don't stick to each other. And the main thing is that you're just trying to make sure it stays tight all the way down. And if you don't want it to be this long, you could certainly cut it with wire cutters. I'm going to kind of make mine longer so that you can see how long it will get if you don't cut it down. And then just kind of folding it over on itself here, the very ends. And you can place, of course, another piece of tape over those ends and then another one in here. But just to kind of show you what you're going to get. The nice thing about this too is that you can always modify it, if you're wanting to make bigger turns. So now you're starting from here. You always have them keep their elbow by their side to really work on elbow and wrist and not fingers. And now you're going to really work on the wrist range of motion, going all the way from one end to the other. And sometimes they forget which direction they're going. So you can always put a little label on one, like a little piece of blue tape on one side. That way, if your goal for them is to do 5 round trips, they can see exactly where they've started and where they've stopped. So less than $3 versus the $60 you would pay in a catalog.